I'm going to turn things over to our moderator for this evening, Sally Galante. She is the Associate Psychologist at the Ethan D. Schaefer Center for Learning Differences. She received her master's and doctorate in psychology from North Carolina State University and completed her postdoctoral fellowship at the Schaefer Center last year. Please welcome Dr. Galante.
Thank you. Thank you, Doug, and thank you everyone for joining us this evening. As Doug had mentioned, tonight's topic is a timely discussion to have as there has been a rise in the prevalence rates of anxiety among children and adolescents. So my hope for this discussion is that we can talk about what anxiety is, how it can manifest in different settings, and how you can help your child or student who is experiencing anxiety. So just a few items before we get to our programming this evening. When you arrived, hopefully you picked up both the PowerPoint handout and the program evaluation. If you didn't, they will be available at the end. Please take a moment to fill out the evaluation form and let us know what you think of tonight. You can return these forms to Renee Lewis and others who will be holding baskets as you exit. If you're a professional attending this event, certificates of attendance are available should you need one. So now this is the title of our presentation, and let's get to just a brief overview. So we are going to start with presentations by Drs. Dukes Murray and Barlow. Then we'll follow with a moderated discussion, which will include questions that were formulated based on the questions that you submitted when you RSVP'd to this event. Last and most importantly, we'll get to your questions from the audience. Okay, so let's get started. First, I want to introduce you to Dr. Heather Dukes Murray. Dr. Dukes Murray is a licensed clinical psychologist in Ohio. She earned her doctorate in counseling psychology from the University of Georgia, and she has completed advanced training at Child and Adolescent Behavioral Health in North Canton, as well as the University of Pittsburgh School of Medicine and Autism Assessment at Daily Behavioral Health. She specializes in the assessment and treatment of children and adolescents with autism spectrum disorders, attention deficit hyperactivity disorder, learning differences, and mood and anxiety disorders. You may also recognize her as she has been the consulting psychologist here at Lawrence Upper School for the past 2 years. Thank you, Dr. Dukes Murray, for joining us this evening, and let's all give her a warm welcome. I'll turn it over to you.
All right, so today I am going to be talking a little bit about, we're going to cover a bunch of different things today. For me, I'm going to be talking about bad stress versus good stress. I'm going to be talking about how our kids experience this stress, how stress might turn from just anxiety to an anxiety issue, an anxiety disorder, some different types of anxiety disorders, and then Megan's going to be talking more about the social aspects of treatment, things like that, okay? In your handouts, there's a sheet that has some boxes. Okay, it says anxiety symptoms, school home, red flags, coping skills. The reason why I gave you those is because it helps me, and sometimes kids at Lawrence, we like to use graphic organizers, okay? So while you're listening to us, I want you to think about that kid that you're here to think about, okay? Take away the pieces from me as to what are the anxiety symptoms you might be seeing. What are some of the things that are happening at school and at home? Okay? What are some of the coping and resources that you're hearing from us that might be helpful? And if there's any red flags that maybe you should consult with somebody else about what's going on, okay? Because sometimes, I have 4 kids, I understand that sometimes you don't always see things, okay? And you might not be quite sure what you're looking at. So sometimes if you write it down and you figure it out and you're hearing from us, this might be an issue, this might be an issue. It's not at all diagnostic, but it might help you kind of guide what you need to do next for your child, okay? So that's why we have that handout. So first thing that I'm going to do is I'm going to talk about good stress, okay? We all experience stress. Every day you're probably confronted with different situations in which you feel that heart beat a little bit faster, okay? You start to breathe a little bit faster, you feel a little bit stressed, and that helps you with performance, okay? Stress is our body's way of kind of waking us up to get ready to meet the challenge that's in front of us. Now, what makes it good stress is that you can manage it. You have the perception that you can manage whatever the situation is, all right? So what do I mean by manage? I mean that you have previous experience, you have the skills, you feel confident in your skills to manage this situation, okay? So if I am a child who is a typical learner and I'm in a school setting and I have a test who's put in front of me, and I know that I studied last night, and I have a history of doing well whenever I study, okay? And I slept well, and I paid attention in class, and I feel well rested, and I'm a typical learner. My heart beats a little bit faster, I start to breathe, I look at the first question, and out comes the answer. And then my anxiety decreases, and I'm like, I'm in the groove, I'm writing my answers, we're doing okay, okay? We're moving along. And that feeling of, oh, okay, is reinforcing that I can manage this situation, okay? This happens in all aspects of our life. Friends, changes, transitions, new environments. If I have previous experience, if I have the feeling that I am capable of handling this problem, then that stress is good stress. Now, if I have a bunch of stressors, and I'm trying to manage all of these stressors, then it can become a situation in which one of them becomes a bad stress, all right? Because I'm not feeling as confident in my ability to handle them. Okay, so too many stressors can cause some bad stress. And then we can think about what makes bad stress itself, okay? Bad stress is the feeling like, I don't see a way out of this. Okay, so you think about that. And you think about your kids, and think about what are the areas in which they are struggling with anxiety, and why do they underestimate their ability to conquer this problem, or why do they doubt their skills? Okay? In bad stress, we don't really see a way out. It could be real, I can't see a way out of this, or a perception that I don't have the skills to handle it. Okay? When other people are looking at you going, you can do this, I know you can. Okay? But their perception is perhaps they can't. So take a child with a learning difference, maybe an undiagnosed learning difference. Okay? So if there's Lauren's parents, maybe you think back to when they were younger and they were starting to really kind of have some difficulties at school. All right? And so there's a child who is trying their hardest. They are studying. They're putting in hours and hours and hours at night. And their grades are coming back, and it's not what you would expect for a child. It's discrepant than what you would expect for a child who's put in this much studying. Okay? And they're not picking up as much, and they feel that. And no matter which keys they try, they're getting messages because they might be in an environment that's incompatible with their learning style, that they're getting messages that maybe you just need to try harder. Maybe you need to study more. Okay? And so they start to feel like no matter which key I try, I can't open this door. And then you're in a way that you don't see a way out. Everything that people are telling me isn't really helping me here. Okay? So you start to think, I'm not good enough, I can't handle this, and it becomes a chronic stressor. Coming to school, this is all across in different areas. So social, if you have social difficulties and you don't quite know how to decode that social interactions can become chronic stressors. If you're at school and you're not quite able to master your reading fluency, and you have reading all the time and you feel behind, that can become a chronic stressor. And we know that chronic stressors lead to depression and anxiety. Okay? When we are chronically stressed, it causes changes, chemical changes in our brain that can lead to depression and anxiety. So it makes sense if we have children who have anxiety disorders, so if we have kids with ADHD, autism, any kind of learning difference, that we have higher rates of anxiety disorders among this population. Okay? In kids with ADHD, they have so if I have 100 kids with ADHD in front of me, 18 of them will also have a co-occurring anxiety disorder compared to 2 in a typical population. Okay? In kids with autism, if I have 100 kids with autism in front of me, 50 of those kids will meet criteria for an anxiety disorder versus the 2 in a typical population. Okay? In learning differences, they've done some really interesting studies that show that kids with learning differences have higher rates of stress across the board in all areas, higher rates of anxiety across the board, not just in academic areas, but in social areas, in relationships at home. They have higher levels of stress and anxiety than their typically learning peers. Okay? So our kids are in a lot of stress. They experience a lot, and they don't see a way out. So Whenever we have bad stress and it is chronic, then we can start to turn into a difficulty where we start to think about, do I need to consult with somebody about my child? All right? So what is the difference between just an anxiety moment and when it's a disorder? All of these things up here are a constellation of symptoms. People have different views on disorders, but as psychologists, we understand that they are constellations of symptoms, and they help us convey to one another and to parents what is going on and how do we guide treatment with it. Okay? So it's not identifying something that is particularly wrong with your child, it's just identifying what we are seeing and how do we guide treatment. Okay? So, generalized anxiety disorder. These three up here are some of the more frequently seen ones that we see in kids and adolescents. There's also other ones, OCD, phobias, things like that, okay? But generalized anxiety disorder is whenever you have a variety of concerns, a variety of worries that happen frequently, okay? So you're hearing a lot of what ifs, questioning, a lot of concerns and anxiety about things. Okay, so when it's excessive. And the key piece of it is that the kid is not able to control it. All right, so whenever you say, let's breathe, you try to distract them, you try to move through it, and they're not able to kind of turn it off. You keep hearing it come back. Okay, then that is a concerning piece. If they're not able to control it and if it's impairing their functioning. Okay, panic disorders. Panic attacks are something that can happen with any kind of anxiety disorder or can happen on its own. All right? Panic attacks are physical manifestations of anxiety, all right? But they're very real, okay? So there's like this perception that it's kind of like in your head, and it's not really in your head. It's a physical manifestation of what's going on. And so if you've ever had a panic attack, I know I myself have panic attacks, okay? As a psychologist who knows exactly what is going on, it is one of the scariest things to try to pull yourself out of it and talk yourself out of it. And I know what's going on. But that feeling of impending doom, the feeling that my throat is closing up, the feeling that you're going to throw up, there's that concern in the back of your head, like, but what if this is going to actually happen this time? Okay? So I'm like, no, it's a panic attack, it's fine. What if it's actually real this time? Okay? And that worry is the hard thing to combat. Okay? So we're going to talk about how to work on that. And then Megan's going to talk about the social anxiety piece of things. All right? So how do we see anxiety? How does it present? What are we looking for? What should you be kind of looking at in your kids? Excessive worries. What ifs? What if there's another storm? What if the power goes out? Okay? What if I don't make it to school? What if we're late? What if I miss the bus? What if I don't get an A on my test? What if, what if, what if? And when I say what ifs, it doesn't always have to phrase in the form of what ifs, but statements. I'm going to fail, okay? Because in their head is the statement of what if I fail, right? I'm going to fail. I'm sure I'm going to fail. I'm going to fail, okay? And if a kid is saying it to you, they're probably saying it many more times in their head. And that's important for us to know. Excessive questioning. What's going to happen next? Where are we going? Who's coming? Who's picking me up? What are we doing? That kind of need for reassurance and that reaching out for somebody else to try to help them deal with the anxiety piece of things. So this excessive questioning can be a sign that they are feeling very anxious and they feel the need to have somebody else help them regulate. Okay? So you respond, they feel a decrease in the anxiety, but that decrease in the anxiety then reinforces the questioning, so they reach out again instead of using a coping skill. All right? So something to keep in mind. Over-concern with school performance and people's perceptions. Really focusing on what are other people thinking? What are other people going to say? What if I don't do well here? What if I don't do well there? Holding value in what other people are perceiving them to be, which is a very largely typical thing for preteens and adolescents to really hold the value of what other people think of them. But if it's controlling and impairing their daily lives, then it becomes a difficulty. Irritability. This is what we see a lot of. Okay? If you are someone who gets grouchy when you're irritable, when you know you're running late and you hear yourself start snapping at your kids, okay? That's the irritability that I'm talking about, that sudden, let's go now kind of thing, all right? Which I do a lot. So that kind of anxiety piece where you're like, you get in the car and you're like, I can't believe I said, our kids are doing the same thing. Okay, they come in and you can kind of tell it wasn't a great day and you're like, how was your day? Blah! Right in your face, okay? The sudden shift in mood. We're doing okay, we're doing okay, we're doing okay, we're not doing okay. What happened? We had a great day. And then it explodes, and 3 minutes after the explosion, we're kind of okay again. All right? I've had some parents who are like, is he bipolar? I don't know what's going on. No, this is anxiety. Okay? That sudden explosion of upset behavior, that's anxiety. Okay? Difficulty concentrating, mind goes blank. So frequently you'll hear that in kids whenever they're going to take a test. I just couldn't remember. I couldn't remember it. Okay? Or if they're at home and they're forgetting things and they're kind of constantly distracted by what's going on in their head. All right? So we have to think about that. Fight, flight, or freeze. This doesn't look like what you might think it looks like. I've worked with a couple kids wherever I'm working with them, I'm like, wow, you are perfectly demonstrating for me fight, flight, or freeze right now. I don't say that to them. It's in my head. I'm like, wow, this is amazing. It's like textbook, okay? A kid who puts on their backpack and tries to leave, okay? We're fleeing, you know? We're leaving right now. That's anxiety, okay? Freezing, putting your head down, refusing to do work, okay? Fighting, combative. I'm not doing it. Not doing it. Not going to happen. Okay? These are all anxiety reactions. Somatic physical symptoms. If your kids go into the nurse a lot and there's no real physical reason for why, there's the reason why. Anxiety. Anxiety does it. Okay? Headaches, stomach aches, acid reflux, feeling dizzy, feeling you're going to throw up. Okay? These are all very, very strongly tied to anxiety. So he's fine at school but explodes at home. We hear this. Okay? He can hold it together all day long and then he comes home and it's awful. He or she, either way. Okay? So think about this as, there's an analogy, you guys have probably all heard it, but you have a cup. And in that cup you can only hold so much stress in your day. And so usually on the weekends, if someone does something kind of jerky to you, you're able to kind of respond in a way that may or may not be approved by your parents, but at least it empties the cup a little bit. Okay? So your brother kicks you, you're able to kick him back, your mom yells, you emptied your cup a little bit. There's a little bit of stress, but you responded. At school, we have to be on our best behavior, and there's a lot of stressors at school. Okay? We have to follow directions, we have to transition well. Okay? We have to deal with the idea that people are always around us and always kind of watching us. You have to deal with social difficulties. All of those things can set you up to fill up your cup because you don't have a way to really let it out. Okay? If you're a child who deals with anxiety, you may not have a way to let it out. You just hold it in. So if I am a child, I come to school, I realize that my transitions aren't going to be great. Well, I don't realize this, but in transition, some kid's standing too close behind me, and he's walking and he's kicking my feet as we're walking. Or we're doing something kind of crazy in the gym, and a kid accidentally hits me or something like that. Okay? Instead of reacting, I hold it in, and my cup gets a little bit full. Then I have to deal with lunch. And I'm trying to follow the conversation. We're trying to have a good time, but this person's giving me a funny look, and I'm not sure why they're giving me a funny look. And I try to ask them about it, and they kind of turn away, and I don't really know how to handle the situation. So I hold it in, and it goes up a little higher. And then I didn't do what I was supposed to do for homework, and I tried to explain it to my teacher, but she got a little bit upset with me, and she said, you know, I needed to get a homework completion pass or something else, whatever happens at your school. And I have to swallow that. A little bit higher. And then I got my quiz, and I sat there, and I'm like, I don't remember this, because I've already had a whole lot going on that day, so my mind is already kind of moving along, right? I'm kind of thinking and ruminating on all these different things that have happened today. I'm feeling kind of grouchy. I get my, and now we're up here. But I don't get upset. I hold it in. And then I get home, and I see the people who I feel comfortable around, and they say, how was your day? Blah! And all of this falls out, okay? And then we feel a little better. So this kind of helps, and it's hard to explain that to schools, and it's hard for us to understand at home sometimes what's going on. So it gives you a little bit of context about it. So this is an anxiety curve, all right? This is based more for professionals, but I want to help walk you through it because it's important for parents to know as well, all right? So on 1, this is where we learn. So as we go up, anxiety is increasing until we get to a 5, and that's like an explosion. Like people are really upset, we're yelling, or we're, stomping our feet, throwing things, whatever, okay? And then on the way back down is whenever we're kind of getting ourselves back together, all right? So we escalate, 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 de-escalate down to the bottom. 1 is where we learn. We can learn coping skills at 1. That's just about the only place we can learn coping skills, which is hard if you have a kid who you're trying to teach coping skills to whenever they're at a 2 and they're already a little bit irritated, okay? They're not getting through really anywhere besides a 1. Okay? So at 1s is where we learn. This is where we plan. This is where we practice our coping skills, because you have to practice them. Number 2, this is where you start to see a little bit of signs of anxiety. So it might be if your child just stops smiling. Okay? So it's not like the actual irritability, physical kind of stuff. It's more like when you first realize that your kid is not happy, but you think you can turn it around. We frequently miss 2. And that's your best place for intervention, when you first get a tiny shift in your child's mood, okay? And that's when you can say, you know what? I think, I understand this situation was upsetting, blah, blah, blah. Why don't we use this particular coping skill? And Megan's going to talk about coping skills, but one thing that I want to kind of impart is that you have to practice them when the person's at a 1, or else suggesting them when they're at a 2 is going to get you a whole lot of a quick escalation to a 3 or 4. Why don't you just breathe? And they haven't practiced it at all. Oh, that's not going to work, and they're going to be mad at you about it. Okay? So 3 is wherever we need to kind of get ourselves out of the anxiety-producing situation. Okay? This is where we might be able to convince about a coping skill, but you're iffy. If the coping skill is really, really hammered in there, if they really have that as a good coping skill. 4, we need to kind of model calmness. We need to be calm. We need to be the empathic responder. Okay? 5, we are just trying to contain at this moment. There's no real redirection at 5. Okay? We are at the top. We are waiting it out. When we start to get down to 4, 3, again, we're just using redirection. We can use calm redirection down here at 2. We can start talking about coping skills down there. But really at 4, 5, 4, we are being a calm, empathic responder. Okay? We are listening. We are understanding. We are getting to a calm place. We are giving time and space for this person. Okay? We can start talking about coping skills when we get a little further. We don't discuss what happened and plan for next time until we're back down to a 1. Right? So when you're at a 3, it's not the time of, okay, so what exactly happened? Because we're going to shoot back up again. Okay? We have to wait till we're all the way back down to a 1. Okay? As well as one thing for you guys to kind of think about is that we also have our own anxiety as parents, as teachers, as professionals, whenever people are in this anxiety curve. All right? So if you've ever had a kid yelling at you, you feel your own anxiety kind of twisting. All right? So we have to be aware of that. We have to monitor it because we can't be empathic responders if we are our own kind of anxiety curve and we're kind of like thinking in our head, why are they doing this? What is happening? I need to go to the grocery store. All of these things. Okay? So being present, being grounded, taking our own deep breaths, and not letting their anxiety be our anxiety. Okay? So that's the form. Keep working on that. All right, so go for it.
Okay, great. I'll just put this over here. All right. Thank you, Dr. Dukes-Murray. Okay, so next we have Dr. Meghan Barlow with us. Dr. Barlow is a licensed clinical pediatric psychologist specializing in assessment and treatment of children with autism spectrum disorders, anxiety, attention deficit disorders, behavioral concerns, developmental issues, and chronic medical problems. She earned her doctorate in clinical psychology from Kent State University and received advanced training at the University of Louisville School of Medicine and Cleveland Clinic Children's Hospital. After working at the Cleveland Clinic for several years, Dr. Barlow opened up a private practice in Rocky River. In addition to owning a private practice, she serves as a member of the board of directors for Connecting for Kids. Thank you, Dr. Barlow, for joining us this evening. Let's give her a warm welcome.
Thank you. Okay, so I think Heather did a great job of setting us up to talk and understand that when people are at that peak anxiety, that 3, 4, 5, really 5 especially, they're feeling extreme discomfort. But lots and lots of kids, young kids, tweens, teenagers, adults, lots of us feel uncomfortable in social situations. And I'm talking about the social piece right now. So lots of us feel uncomfortable in some social situations. And Heather alluded to those kind of teenage years where you might just feel sort of awkward or uncomfortable having to maybe speak in class, or your mom's bringing you for an open house or something, and you feel like your mom is doing something weird, and so you tell your mom, stop doing something weird. Not that I have any personal experience with that. But so lots and lots of kids feel uncomfortable in some of these situations. And a lot of times parents ask the question, is this just kind of normal? Like, is this a part of their age? Is this a teenager or, a 10-year-old, a tween kind of thing? Or sometimes this is like my kid's personality. This is their temperament. Maybe they're just a little bit more shy, they're an introvert or something. They're not very outgoing, and so maybe sometimes they feel uncomfortable having to make a conversation in public or something along those lines. And how we try to determine, I think, how psychologists or therapists who are really working with and trying to think about, does it cross the line from just a temperamental sort of preference or style, or a developmental kind of appropriate self-consciousness or feeling awkward or uncomfortable from a disorder, a social anxiety disorder? There are a couple things that we look at. So when somebody is more temperamentally or developmentally feeling uncomfortable, it tends to occur in the moment. So that's when your mom is walking you down the hall, asking your friends which team they're on or something, and responds cool, and you think your mom is being weird, and so you say, Mom, please stop being weird. And then you walk down the hall and you kind of forget about it. You're on to the next thing. You're thinking about finding your locker or whatever else. That kind of in the moment thing. Whereas people who have anxiety disorders, they do a lot of thinking about the situation, a lot of analyzing the situation before and after the fact. So we call it anticipatory anxiety. There's a lot of thinking about what's going to happen. Well, what if I can't open my locker? What if it gets stuck? What if I have to talk to a teacher and ask them how to open it? And it's all this stuff beforehand, as well as sometimes afterwards, thinking about, kind of ruminating, like, oh, well, when my friend said this, then I responded this. Did they think I was stupid? Was that embarrassing? And kind of playing that in your head again, over and over. People who are developmentally or temperamentally feeling uncomfortable in a social situation, they tend to do better after a period of warming up. So, a birthday party or something along those lines, they might feel kind of uncomfortable. They might want their parent to hang around for a little bit before they leave, and they feel kind of uncomfortable, but then they warm up. They get distracted by the activities, by the party. Once they get a sense of like, okay, I know who's here, I know what we're doing, they calm down. They may or may not be in distress. So sometimes this is really important when we're thinking about temperamental kinds of shyness or introversion. Sometimes people will tell me, oh yeah, I'm very awkward in social situations, but it just doesn't bother me. That's just how I am, there's no distress. People who are socially anxious, they have an intense feeling of distress. They feel horribly uncomfortable, and that warming up period, until they've gotten very good at practicing their coping skills when they're at a 1, that warm-up period doesn't really do it for them. They tend to feel anxious that entire time until they get better and better at managing their anxiety. As Heather mentioned, some of these, I'm referring to them as easily understandable situations. So things like having to give a class presentation, or meeting somebody's parents or something for the first time, or whatever. Those are situations where people tend to feel a little bit like on guard. They're trying to be their best. And Heather did a nice job of explaining that good stress versus bad stress, and that's what I'm kind of talking about here. With people, when we're talking about that temperamental or developmental, sometimes it's really limited to a group. So it could be that sometimes kids are more comfortable talking with their peers, but they start to feel uncomfortable or nervous around teachers or grown-ups. Other times they feel more comfortable around grown-ups and are uncomfortable around their peers. And maybe that's a signal that, maybe they need some help in another area, whether that's social skills or something along those lines. But so it can be limited to a group. And with socially anxious people, we see it as a bit more pervasive and this interference with functioning. So it actually really gets in the way of them doing the job of, if they're 10, doing the job of a 10-year-old, doing the job of a 13-year-old. So that means things like, doing social events with your peers, going to school. We see a lot of kids who just refuse to go to school because they are so anxious, whether it's because of a social anxiety or maybe an undiagnosed learning disorder or something else going on. We don't always know right away, and that deserves a little bit more of a exploration to figure out what's going on so we can provide those supports. When we're talking about social anxiety, some of the diagnostic criteria that are important to consider are these fears about social situations in which they can be scrutinized. So when Heather was talking about those kind of what-if questions or this is the statements that people might make, the kinds of statements we hear in social anxiety has to do with people are looking at me or they're laughing at me or feeling as if they're on stage and being and sort of walking across the cafeteria with all eyes on them. And fears about acting in a way that might be embarrassing or humiliating. So sometimes this crosses over, like Heather was mentioning, panic disorders, and sometimes people feeling like they might throw up. Sometimes this works hand in hand with the social anxiety, because then it's like, I'm going to throw up and everyone's going to see me throw up, and that's going to be the most horrifying moment of my life. So this sort of kind of co-occurrence we sometimes see. But the social situations really provoke true fear. And we see that in the fight or flight or freeze, sometimes or crying or refusing to do something, that's the avoidance. Or they endure it, but with intense levels of fear and anxiety that they report. And then maybe they don't want to do it ever again, go to school or whatever. The fear and anxiety experienced is way out of proportion with the sort of threat, so, and that kind of gets to that good stress and bad stress, that a lot of people probably should feel a little bit of stress when they have to give a class presentation. It helps you prepare, it helps you, dress nicely or whatever, and try to communicate your ideas to your class. But if you really feel like you can't survive that moment, like you are going to die, that's probably out of proportion with what if I mess up, or what if I get something wrong. When we're talking about a social anxiety disorder, we're also looking at the length of time that these symptoms are experienced, especially when we're talking about comparing to like developmental transitions and things like that. A lot of people are uncomfortable starting a new school year. But then they warm up. They get used to it. It kind of fades away. People with social anxiety, it lasts. So it lasts longer than 6 months. And that significance interference in functioning. Okay, Heather has her curve and I have my curve. Mine is a lot less detailed, but I love Heather's curve because Heather's curve is really prescriptive for the adults who are working with people who have anxiety. And this curve I draw a lot to try to explain anxiety to kids and teenagers and their families. And I explain a concept called habituation. So this is the way that we do that. Draw up a curve, and you might give an example like, let's pretend you're the kind of kid who loves to go swimming, but you don't like being cold. So you get in the water, and it feels cold. So you get out of there. And you go, your mom wraps you up in a towel, you're her little burrito, nice and cozy and warm, that feels good. Okay, now I'm gonna go swimming because that's fun. You get in the pool and it's cold. So you're out of the pool, you warm up, that feels good. Then you wanna go swimming again, so you get back in the pool, it's cold, you get out, and you're just stuck here like in and out of the pool, you never actually get a chance to swim. But let's say you stayed in the pool, what would happen? And most kids can eventually get to, like, it feels warmer. And you can ask, well, did you put a sweater on? Did somebody demand that the heat in the pool gets turned up? Or like, what's happening? And they can say, most of the time you get used to it. And that's what we want them to understand about that uncomfortable feeling that they experience with anxiety, is that you will get used to that uncomfortable feeling if you give it some time and if you have the tools to help you stick with it. So if you go in the pool and you stay, you do not escape. That's that flight, by the way. Escaping is flight, in fight or flight. You don't get out of there, you stay in. That yucky, uncomfortable feeling will go away, and it will get better. And so then we make it specific to whatever their anxiety is and help them see that. And then it's not like now you're over it. You're never going to experience that uncomfortable feeling again, but that curve might not be as high, or it might not last as long. That going up part might not last as long. So it can turn into more of like a bump over time and with practice and when you practice the tools. So we spend a lot of time also talking about triangles, curves and triangles. Anxiety. Whenever there's anxiety, we talk about anxious thoughts. That's the what if, or those statements, those negative statements. Catastrophizing, paying attention to the negative things instead of what good could happen. But there are certain patterns of thinking that we know people with anxiety fall into. Sometimes we call them thinking traps. People with anxiety also experience a physiological reaction, whether it's the butterflies in the stomach or headaches or tight muscles. There's a physiological component to that as well. So we want to help people understand what are your anxious thoughts, what happens in your body when you're experiencing anxiety, and what are your anxious actions? What do you do when you feel anxious, when you feel uncomfortable? Is that when you go to the nurse's office? Is that when you call home? Is that when you call out for your parent in the house? There's a lot of, Mom? Yeah, nothing. Dad? Yeah, nothing. Just those checks. That checking to make sure that everything is okay. So we try to find out what are your anxious actions, what do you do? And then we get into, okay, so now we know what happens when you're feeling uncomfortable. Now we're going to be talking about some tools that we can build for helping you feel calm. Because when you're calm, you have calm thoughts. There are things you can do to help your body get calm, and there are calming actions, things you can do that are very calming activities. I'm drawing ladders a lot of times, and ladders come up with social anxiety a lot, but other types of anxiety as well. The idea with a ladder is you draw up this ladder and you say, okay, so at the top of the ladder, that's your goal. That's what you want to be able to do. Is it that you want to be able to order your meal in a restaurant by yourself? You want to be able to ask the server to bring you whatever it is that you want. So when we're coming up with the ladder, we break it down into more manageable steps, easier chunks that we can break down that overall goal and help an individual get closer and closer to achieving that goal. Because if you tell them now we're going to go to a restaurant and you're just going to order, you just have to order. I'm tired of, you're 15. It's kind of weird. It makes me feel anxious when I have to order for you. So you got to just do it. You're going to get a lot of fight or a lot of flight or a lot of freezing in the restaurant if you haven't practiced a lot of these skills. And sometimes that practicing is breaking it down. Now, important though, when we're talking about the steps, breaking it down into steps, is that you want to get input from the child. So you want to make sure that whoever is experiencing the anxiety is the person who's saying, okay, that's probably the easiest thing I could do. Because I might suggest, well, how about you just look at the waiter, make eye contact and smile with the server. And that person might say, oh, no, that will knock me over the edge, because if I make eye contact, then I start thinking, what are they thinking about me, and blah, 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 blah. I would much rather look at the menu and order my drink, something like that. So you got to have them figure out what the steps are. You move at their pace, and this is all important for helping a kid feel in charge, in control, and engaged in the process. So just to kind of sum it up in terms of the tools, some important points. Education is really, really important. So what we are going to be doing, I mean, all of this is cognitive behavior therapy. And what we do in cognitive behavior therapy, the first step is education. So we want people to understand what happens in their bodies, what happens in their brains, what they do when they're feeling anxious. And we want the adults around them to understand that too. We are teaching lots and lots of tools. It's like laying out a buffet of tools because especially when we're talking about adolescence, there's a lot of resistance sometimes. You know, sometimes people are in such distress that they're very open to trying anything. Other times it's like, that's not going to work for me. That doesn't work. That's stupid. I don't want to try it. You know, I try not to get into a power struggle about breathing helps. Breathing works. Just practice your breathing. You'll see. Because I think it's much more important to convey a message that there are any number of tools you can use to calm down your body, calm down your mind. You might like some tool that the kid sitting next to you doesn't like. So try them, figure it out, pack your own toolbox, you know, and so we give a lot of ownership and control. And you also send the message that if this isn't working perfectly, we can tweak it, or we can keep looking, that there are other ways to do that. When I say vary the types of tools, I also mean like a lot of kids are really good at distractions. So they'll do things if they're anxious, like go on a screen or something like that, and that helps them manage their anxiety. And that's great. That's one tool that can be very, very helpful in certain situations, but you want to make sure they have other tools as well, like being able to change their thoughts or calm down their bodies through some type of relaxation. There are tons of resources available. You do have to do a little bit of looking. Sometimes I give names of workbooks that I like, but the truth is, I think the best thing to do is go to a bookstore and go to that section and flip through them, because there are going to be some books that you can just tell your kid is not going to connect with, or certain examples that you're like, that's exactly the conversation we have every night at dinner. That's the book to get, you know. So look through lots of different workbooks and materials to see what would help you. Videos. So there are also, you know, YouTube has everything. And so if you are talking about, okay, what's this breathing? We heard people talking about deep breathing. Go on YouTube and search breathing for relaxation, and you will find people teaching you how to breathe for relaxation. GoZen is a web-based program that I think has a lot of useful tools, and the website's just gozen.com. But it's video vignettes teaching what happens in your brain and in your body when you experience anxiety. There's a school version, a professional version, and a parent version, and they have webinars and things like that. And then I've been using apps a lot lately with especially my teenage kids that I work with, because they like their phones and it gets their attention. And I'm always thinking about how to try to shape their coping strategies into something that's a little bit closer to what I ultimately want them to end up doing. So what I hear from a lot of teenagers is who are allowed to have their phones in school and things like that, that they're having a panic attack, they go to the bathroom and they start texting their parents. And their parents then are texting back like prompts for, okay, remember about your breathing, remember about this, remember about that. And their parents are doing a lot of coaching like that. That might be appropriate for a specific kid at a specific point in time, but sometimes the apps allow for that kid to take on a little bit more independence. So for example, there are a lot of apps that have grounding techniques for people who are experiencing a panic disorder. So they'll open up their app, and it asks them questions like, name 5 fast food restaurants, name 5 states you've visited, name 5 types of cereal. So it kind of distracts you, moves you into the thinking. So anyway, those are the tools, and I know we've got some questions to get to.
Great. All right. I think if you want to sit over there. Oops, sorry.
That's okay.
All right. Thank you, Dr. Barlow. Okay, so now we are going to move into the moderated discussion. Our first question, let's see. Okay. Dr. Dukes-Murray talked about number 5, the top of that curve. Dr. Barlow, when children are experiencing intense crying and panic at that 5, maybe even at a 4, what are some things that parents can do in those moments to help?
Oh, well, I like that Dr. Dukes-Murray was driving the point home that teaching, that happens on the level 1. So I think at a 4 and a 5, when parents or adults are talking at all, I think that usually extends the 4 and 5 time. So I think it's best to actually stop talking and just give a lot of space and time. But I do think that if you're in the 1 and you're coming up with plans, it's a great idea to talk to kids or teenagers and find out, what do you want me to do? Does it help when I sit next to you? Does it help when I rub your back? Or what do you want me to do?
Great. And Dr. Dukes-Murray, how can parents and school professionals work together to help children in those moments?
So I think one thing that we harp on quite a lot is communication. So if you're coming up with a plan at a level 1, that you call up whoever first you identify the person at school who's your kid's person, So who is that person who your child feels connected to or who they trust? Okay, who's their homeroom teacher, who's the person who's most engaged, and get that person to understand what the plan is for a level 1, when they're at a level 1. So what you've come up with, what their coping skill is when they're up here. Okay, so communication and making sure that they understand what it is that's going to be helpful. If your child's a little bit older, they could also even advocate for this. So you communicate and then you say, my kid would like to talk to you about this, that you can kind of do a dry run. What are we going to do when I get upset? Where's the place in the room that I can go? What is the code word that I'm going to have that I'm feeling really anxious and I need to go take a bathroom break and then I'll be able to come back? Okay, so planning ahead is really key, because in those intense moments, what's going to be most helpful is that we remain calm, we get them to a place where they are safe if they're not in a safe place, or we provide an area of calmness and we let it move through. Okay? If it's more of a panic attack type thing, then we need to think more about it's important for the person who's and by panic attack, I mean feel like they're going to throw up, their heart's racing, they feel like their throat's going to close up, that kind of thing, and not so much like an anxiety outburst, like a meltdown type thing, so a panic attack where they're feeling really physically kind of thing. Then you want to be calm, be assertive, tell them, I know what's going on, we know that you have panic attacks. I'm going to tell you what to do at this moment. So you start to use calm statements, but the kid has to know this is going to happen. So again, out of 1, these are the things that we're going to do. I'm going to help you find a seat. We're going to start doing grounding techniques. We're going to do this. And you talk them to a point wherever that mental distraction away from focusing on the physical symptoms. If you focus on the physical symptoms, it extends the panic attack. My throat's closing up, my throat's closing up, my throat's closing up. It keeps going and it keeps releasing more cortisol and you keep feeling the panic attack, okay? If we're able to shortcut that and distract ourselves and start thinking about something else, your body stops releasing the cortisol and it shortens the amount of time that you'll feel that panic attack, which is really hard to do. But as the adult in the room, you have to be the one to take charge and be very calm about it, okay? But if it's a meltdown, then space and then implementing whatever the coping skills are that you have done whenever they get back down to a little bit down here, okay? Does that make sense? Okay.
Yeah, thank you. Okay. For our next question, we've spent a lot of time talking about what to look for, what signs to look for when our child is experiencing anxiety. So when should parents seek professional help? And then could you also explain a little bit about what they should look for in evidence-based treatment?
Well, as far as when to seek help, I think personally, if you and or your child or your teenager is concerned, it's never a problem to seek help, whether that's talking to their primary care physician or talking to the school or talking to a therapist of some sort, but just to say, this is what's going on and we maybe need an outside opinion about, is this normal? Are there some tools that you can suggest for us to use? I will say that there are some people who come for an evaluation and that's all they do. They come for a consultation. They want to get a better sense of what's going on here? What are some things that we can try at home and that can work for them? There are other people who, are engaged in much more intensive, regular therapy appointments.
And kind of on the same vein is that it's better to kind of catch things earlier than it is to wait until it's a full-blown, we're melting down in things constantly every day. So even if you don't hit that criteria I was talking about, if you're seeing something consistently and it's a consistent issue, then seeking out guidance from your pediatrician, calling for referrals, talking to the person at school, kind of seeing what is everyone else seeing? What are we doing here? Where do I need to go for this? And reaching out for help. There's usually somebody at the school who knows who to refer to. Your pediatrician usually has a list of people to refer to. But getting in front of it, it's a lot easier to kind of catch things and deal with them early. One thing that I think is important to kind of also keep in mind is that if your kid is doing well, to keep going to therapy for a little while, or keep implementing the tools that you're using, and not taking that as a like, okay, we don't need to go anymore, or we don't need to keep working on this because we're at that 1, okay? And that's where we really reinforce the skills, is when we're at a 1. And that's going to, if we're thinking about anxiety and anxiety disorders, if you seek treatment, it may not completely get rid of it, but it will decrease the amount of time that the child spends in those kind of episodes, and also decrease the frequency of having reoccurrences of it later on. Okay? So it's important even thinking long term. Okay, so my kids in college, but right now they're 5 and they're experiencing anxiety, I need to kind of get ahead of this, that this isn't a lifelong pattern for them. Okay? And then CBT,
yes.
So cognitive behavioral therapy is the main evidence-based practice treatment modality for children who have anxiety difficulties. Okay? And so cognitive behavioral therapy is working on that thoughts, feelings, actions triangle that she was really focusing on. That is the crux of cognitive behavioral therapy. All right? It has a strong evidence base. It is easily translatable to children, adolescents, adults, children who have any kind of difficulty that they're presenting with. Okay? And so a key part of CBT is homework. Okay? So if you're working with somebody and they're doing CBT but they're not giving you homework, you want to kind of see what should I be doing at home, because 45 minutes a week isn't going to change everything. It'll be a good jumping point, but you need to have that at home. We need to have a plan for home, as well as the relationship. So there's the evidence-based piece of it, but if your kid doesn't like the person they're sitting with, that's something to think about. They could be the best therapists in the world, and they're not going to click with everybody. Okay? So if it doesn't work with this person, give it a couple sessions, find another recommendation. Okay?
And then I would say, I think the CBT framework is our evidence-based framework for treating anxiety. But when I was talking about that sort of buffet of tools, there are tools that might not really necessarily fit with cognitive behavior therapy, that might be a little bit more, I don't know if you want to call it like holistic or mindfulness, but I was also thinking about like aromatherapy or like acupressure, some of these kinds of like body awareness to help calm down the body. Different strategies appeal to different people, and so the cognitive behavior therapy part of that is being able to recognize, okay, this is anxiety, and now I need to implement one of my tools. But the tool might be, using some sort of aromatherapy or using a pressure point or something like that that might not necessarily feel traditionally like cognitive behavior therapy. But I say if it doesn't cost you tons of money and it's not going to create any kind of harm and a person likes it and feels benefit from it, it's a good tool to keep in your toolbox. So.
Absolutely.
Okay, great, thanks. All right, let's move on to our last question. So both of you were discussing good stress. And we all know that some anxiety is important to push us, and it's a typical part of doing something new. But when treating children with anxiety, how do we know that we're helping when we're pushing our child? And when do we need to take a step back and support them in the moment?
Well, I think you could go, it's not necessarily an either or. So understanding your child and knowing what the pattern is. So if you know that your child always has some anxiety at the first day of school, you know that this is something that happens, okay? And you know they're sitting in the car and they don't want to go, and you know every year prior this has happened, and they come home loving it, okay? And then smooth sailing for the rest of the year. That's the time when we push them, right? We know this as parents. We say, it's okay, I love you, it's gonna be a great day, I will see you, and you're gonna come home, it's gonna be fantastic, okay? You know that push is gonna be what they need, okay? If it becomes something that is uncharacteristic for your child, okay? So your child has never had anxiety for school, and so they're fighting the first day, they come home, they're a mess. The second day they're fighting, they come home, they're a mess. Then it's time to kind of support them, but maybe not letting them go to school, because that's escaping. Yeah. But we need to think about how do I support my child while also pushing them to engage in the behaviors that they have to do for their age. Okay, so there are some things that we can't let our kids get out of, and we do need to push them and have trust in their ability to handle it. So they're underestimating their ability to handle the stressor. You know that they can. So supporting them, developing plans, getting coping skills together, getting professionals involved, while also pushing them to engage in the activity. Okay?
Yeah, I would say staying calm while you're supporting your child through this. And one of the things that I talk with kids about all the time is like anxiety is bossing you around, so do your best to talk back to that anxiety or boss it back a little bit. So like if your anxiety says, I can't stay at this birthday party without my parents, they have to stay, I can't stay here without them, maybe understanding your kid, knowing sort of what their patterns are or maybe what seems a little bit different, think about how you can help your child boss back that anxiety a little bit in a way that you think they can handle. So it might be, okay, I'll stay here at the bowling alley, but I'm gonna sit way over there. So you're there, you're on site, you're at the party, but you're bossing it back a little bit by doing it sort of on your terms. And that's kind of how I talk about it with kids is like, you gotta try to figure out how to gain a little bit back on your terms. So I think that might be a way to help, support and push at the same time.
Yeah, and I think using your ladder example is also important. So maybe with the birthday party example, starting out by saying, I'll stay at the back of the room. Next birthday party, maybe saying, I'm gonna stay in the car this time,
Right.
rather than going. So you can use that ladder at all points, even at home.
And you're bringing up a great point about the visuals. So you saw a lot of visuals that she uses and that we use. When people are anxious, they have a hard time processing information, and so providing as many ways of having that child receive the information, visual, auditory, that's going to be really, really helpful. Okay?
Okay, great. All right, well, we will now move into the question and answer portion of tonight's programming. There are people with microphones that are going to be on either side of the room, so please raise your hand and they will come to you. And I just want to note that when you're speaking into the microphone, please try to hold it close to your mouth. If you cannot hear yourself echoing in the room or on the speaker, we can't hear you either.
Not to make you nervous about it or anything. Yeah. Don't worry.
And we are live streaming this as well.
So also not to make you nervous.
Pressure. There you go.
But please raise your hands with any questions that you may have. I see one in the middle.
Okay. Can you hear me?
Yes.
I have a question about the anxiety curve and that. Are there different philosophies on that or maybe different interpretations? Because from what I've been told in the past, you do not want to be either at the top or the bottom. You say at the bottom is where you want to be learning and, doing all this. From what I've been told, at the bottom, you can't function at all. You're basically just sort of like there. You don't care about anything. You might walk out in the middle of the street because you think, I can't get hurt. I'm not going to, if I get hit by a car, nothing's going to happen to me.
Yeah.
I've been told that you want to be more in the center, not at the top or the bottom, but in the center, and that's where, you always want to be. They're more concerned if you're at the base of it.
Yeah.
And I just want to see, is that just a matter of interpretation of where the base might be or something? Or
Yeah,
okay.
and so I think it's kind of like we're starting out on that curve, they're starting out on optimal performance, okay, being a 1. So you're talking more about like apathy, so apathy's in the other direction towards more like a depressive type state, So we're talking optimal performance right here at 1, we're cruising along, we're doing great, things are going well. But yes, absolutely, there is the opposite is true.
So that might
Apathy-
actually just be you're only showing a
Right,
upper
I'm
half
starting
of the
here,
curve,
yeah,
where
yeah.
this
You
would
could go
be
sub.
like down below. Okay.
Thank you.
Great question.
Hi.
Hi.
Can you hear me?
Yes.
Yes.
Okay. Megan, you mentioned some apps that you said were effective in working with teens. You mentioned a grounding technique one. I was wondering if you could just give us some of those apps so that I could just jot them down.
Okay, well, I think that the one that that I like the best is called What's Up, not to be confused with WhatsApp or something like that. So the one that I'm talking about is a red square, and it's got like a little hand inside of a big hand. So anytime you're going to watch a video or recommend an app or something, I would definitely, if you're an adult, if you're the therapist or a teacher or you're a parent, look at that video first or check out that app first, because there is in that app like they call it a forum where people can get support from other people. That part makes me a little nervous sometimes, so no pun intended. But I at least like to be able to introduce the grounding, and then there are other components of that too. That's like, it's sort of like a in the moment strategies, as well as, catching your patterns. There's a diary component so that people can keep track. But there are a lot of like inspirational sort of quotes and things like that in that app. So there are some useful things there, but I would definitely encourage monitoring and supervision of those apps.
If you're trying to do more of like a meditation type thing, there's ones that are geared towards that. So it'd be more like, I think Headspace is one.
Mm-hmm.
I think there's one called Calm.
Calm.com.
Calm.com. And those are really great. If your kid likes to use, if they're willing to use that kind of an app to help them, those can be really, really helpful.
I'm sorry, that first one was What's Up?
Yes.
Yes.
Yeah.
Hello, my name is Anthony. This is more catered to our son. I learned a term today I never heard of. I never knew there was such a thing as good stress. And he likes to have fun. He loves his friends. He loves just being on the phone and going to the playground. And he constantly asks us over and over, if we say you're going to play with little Georgie today, he would ask us 20 to 30 times a day, when are we playing with little Georgie? Can I play with little Georgie? He's over and over and over again, and reassuring. So how do we start to get him to just slow down? He's really anxiety, but it's about having fun all the time.
How old is he?
9. And he was born premature. He was a 25-weeker. He has some developmental delays, but he's still in a good state, but he will ask us over and over and over and over again all day long about just having fun.
And so I think a visual would probably be a really helpful thing for that kind of, so if you know you're playing with Georgie at 6 o'clock, if he's good at telling time, you can have one of those digital, or the analog, and you put Georgie at 6 o'clock. Okay, so what time is it? It is 4 o'clock. You see him down here, I see him down here. Okay, and so you refer to the clock. And whenever he says, what time are we seeing Georgie? You go, look at the clock. Okay, and so it kind of removes you from being the coping skills and teaches him to kind of check for himself. Okay, or if he's not so great at telling time, then you can have a visual schedule of we see Georgie after dinner, and you put Georgie after dinner. You can write it down for him, draw a picture, whatever it is that works for him, and then refer to that. So it's helping remove you from being the person who's constantly helping him manage that, and it lets him know, okay, well, right now we're at lunch, so I still have to do this, 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 and then I'll see him. Okay?
And I guess I would tag on to that, sometimes it is like an excited, I can't wait for it, kind of like, what time is that going to be? What time is that going to be? But sometimes I think a kid wants to actually just say that they're excited about it. And so sometimes you can just kind of shift that into like, you're excited to play with Georgie, so you kind of turn it around on what you would rather have them say. Or with some of our kids who have maybe like an autism spectrum and anxiety, this kind of like getting stuck on something comes up a lot. And so sometimes we take the concretes and the visuals, I think, a little bit further, where it's like, almost like you asked, you got the answer, and now I'm not gonna talk about it again. Or where they start to get into a habit of they want your response. So like when Heather was suggesting to say, look at the clock, I think that's a great suggestion, and I would try, if you know your kid gets stuck in sort of rituals, to change up your response, so that sometimes you might say, look at the clock, or you remember what I told you about that, or you might just point to the clock, but where you're trying not to create another ritual of looking at the clock, and now we're talking about what time it is.
Thank you.
Mm-hmm. All right.
Questions from the center section, apparently, tonight. So I have 3 children, 3 boys, and my middle son has been diagnosed with an anxiety disorder, and we are addressing that. My question is, for the other 2 boys, this has been very difficult for them. I mean, it's been difficult for everybody in the family, but our youngest is now hitting a point where he is starting to get stomach aches at school and dizziness. And so I'm wondering if you have any advice in terms of addressing a sibling who is, dealing with an anxiety disorder and how to help siblings manage that. I think it's hard to have a brother with a problem.
Yeah, yeah.
So are you saying that you think the younger sibling is also experiencing anxiety, or you think they're kind of like
I think
mimicking
he's starting to experience it because of what his brother is going through. So
so
I don't
getting
think
anxiety
he
because-
enjoys school. He's got friends, you
Yeah.
know.
Okay.
He's a typical kid, and I don't want to see him be so negatively impacted by
Yeah.
the situation with his brother, who really does have an anxiety disorder.
Yeah, I mean, I think that most of us experience anxiety on some level, whether it's a disorder or not, but that whole framework is the same, whether you've got an anxiety disorder or you're just starting to feel kind of uncomfortable. So remember when Heather was saying, you label like, this is a panic attack. You might even say, oh yeah, that happens sometimes when people start to feel uncomfortable. Here's what we do. And so then you're actually it might be not the level of intensity of focus or treatment or, discussion or time around it that you might find yourself providing for your son who has more significant anxiety, but just that education piece and some coping strategies that align with where he is and what would help him. Remember when you get to school, once you put your binder away and stuff, that tummy ache goes away. That's probably just a little bit of the morning butterflies, like that kind of thing.
And I think also, and it might be related to your question, it might not be, I'm not sure, because my brain goes in different tangents, so not at all about you. But with any child who has a sibling with a difference, that difference can really take up the family's time and the resources that are involved. And so helping carve out time, for each child can be really hard. Again, we have a bunch of kids. And so carving out that time is hard if you're working, if there's so many things to do, but just even, engaging that younger child in helping make dinner, engaging that younger child in, you're the one who takes him to swimming practice and then you sit and you watch him. And it's just that time focused on him can go a very long way in supporting siblings and feeling like, okay, so not everything is happening. And it makes it you don't want to build the resentment. Sometimes kids can feel like he's getting all of that. So if they're getting some attention, and they feel very focused on, and that can be helpful in feeling comforted about what's going on.
Thank you.
Hi, Katie, can you hear me?
Yes.
Sorry, there you are, okay. Okay.
Okay, so mine's a twofold. You were talking about percentages in the beginning of how many people have anxiety. And so my question is there a biological aspect to it? I have severe ADHD, I'm everywhere. My husband has severe social anxiety, and I have a 6-year-old who's starting to show some symptoms of some anxiety, but I don't know if she's learning it from our behaviors or if it's something that she's got going on herself, because it manifests very similar to our stuff,
Yeah.
So.
I think there's a strong genetic component that's been kind of established, is that there is genetic components. If you have a parent with depression, a parent with anxiety, a parent with ADHD, there is that genetic component to it. So it's possible that it's just genetics. But on the same level, there's a good bit of research that anxious parents have more anxious kids outside of just the genetic piece of things. And so if you, it could be a combination of both. That she might be predisposed to having anxiety or to having ADHD. Well, the ADHD seems to be more of a genetic kind of thing. But the anxiety piece could be a predisposition, and then if she's seeing behaviors and kind of they're matching up with what you're doing, then I would think that maybe it's a combination of things. And so one study that I read said that parents who said be careful over small things were more likely to have children who were anxious. Okay, so your kid walks out the door, you say, be careful.
careful.
And it's like, wait, what am I being careful about? Okay, so cutting that kind of out of your mouth, unless it's like an actual situation where you need to say, be careful. And I say it a lot. So it's kind of those things where just be careful. It doesn't need to be your goodbye. So just be careful of what it is that you say to your child, because our words have impacts, and we don't realize the tiny things that we say and how they pop up later on until they're right in your face. So yeah, I think it can be a combination of both.
Yeah, I think that's
My follow-up question is, so at age 6, is that an appropriate time to start getting her help, or start focusing on what we're not saying, or that be careful or whatever? Is there a time frame when it's like, okay, this is our stuff versus her stuff, or an age range, I guess?
If it's impacting her,
Yeah, I mean, I would say both. I would say a part of helping her is you're going to be learning, how to manage her as parents. But most of the parents not most of the parents, but a good percentage of the parents of kids who I work with, like when we're going through a workbook or we're, going through examples, they're like, I can use this for myself, and actually I think that when something's written for a child or a teenager, it's a lot easier to understand
Yeah.
and just you get it and you can you connect to it, and so then I think maybe a follow-up, maybe this isn't your follow-up question, but a follow-up question that I hear from a lot of families is like, or a follow-up conversation, is parents who maybe feel a little bit of guilt for like passing that on genetically. And I think there are probably some pros and cons to having a parent who has anxiety as well and kind of understands it, because if you don't have anxiety, you really don't understand how powerful it is. If you do have anxiety, you get it. The challenge, I think, for parents who experience anxiety, who have a kid who's experiencing anxiety, one of the challenges is that you want to make sure you don't get sucked into their anxiety, that you really are that sort of calm voice of reason. You've got the theory. You're like, nope, this is a false alarm. We don't have to be, we're not in danger here, and that you don't get sucked into it. So I think that can be hard for parents sometimes, because parenting a child with anxiety is anxiety provoking, even if you don't have anxiety, and there's sort of this pendulum of like, you really care, you feel really bad, you're trying to support them, you're like, oh my gosh, my heart's breaking for this kid, and then you're like, just get your shoes on and get in the car, like, I cannot answer your question about Georgie one more time, we're leaving. And so it's like this, back and forth, and then of course you feel guilty.
You feel guilty, and
That's
the
the whole
other direction
parenting
it
thing,
goes,
right?
yeah.
So.
Thank you.
Hi, I have a daughter who has social anxiety and also really just struggles in general with social situations. She has a hard time reading nonverbals. She has a hard time understanding context with other kids. And she also tends to just, everything's a catastrophe, and she plans out the catastrophes that are going to happen before she gets there. So how do you help to navigate that so that these are kind of consume our evenings? We have lots of meltdowns over this, trying to normalize, do some normalization, but how do you help a child with sort of that piece that they have to face every day?
Mm-hmm. I think the first part is probably figuring out a little bit of the chicken or the egg, because I think you mentioned she has a hard time like reading some of the nonverbals and the context cues, and that can happen if you're anxious and you're focused on your internal state and all these like questions and like what are they thinking about me and am I embarrassing myself. It's hard to pay attention to the social cues from somebody else. On the flip side, if you don't naturally pick up on things like nonverbals and context cues and things like that, and you kind of experience this sense of like, I'm messing up, or like I actually am kind of embarrassing myself routinely, or saying the wrong thing, or putting my foot in my mouth, or something like that, and you have these sort of repeated negative experiences, then it can create anxiety. And so I think the first step is trying to figure out sort of what's underlying that, like what's the egg, and then if the egg is, understanding social information, I would be working on teaching that social information, the social skills. If it's the anxiety piece, I would be working on calming down the anxiety, And then you would think that the social, being able to read and monitor and adjust to the social setting would improve as the anxiety improves.
And if it's more of the social skills aspect, like she naturally doesn't have some of the more stronger tools to read social situations, then coming up with scripts, so, you can identify that on every Tuesday we think about what is the situation that we had that happened, over the weekend that we want to try to problem solve, and what could we have done in the situation. So you draw it out and you say what happened here, 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 here. You walk her through those nonverbals in the social situations and you say what could we have done differently, and you try to write it out so the next time she's in a situation where someone comes up to her and says, hey, how's it going? She says, I'm good, how are you? That kind of social kind of scripting so that the person has a good idea as to what do I need to do in the situation, where did I go wrong last time, what did I miss, but only a little bit removed, not right after it happened when they're melting down.
Or even, I think like the hidden, I don't know if people are familiar with a term called the hidden curriculum, but it's like sort of this concept that we all follow social rules. When we're ordering a drink in Starbucks, we all know that if it's like 7 in the morning and there's a long line behind you, you better get to the cashier knowing exactly what you want to order and then step aside quickly. Have your payment out, like you just move through that really quickly. That's sort of the social rule. If you stand up there and you're like hemming and hawing and there's a whole line behind you, people are thinking a lot of thoughts about you that probably are not very nice. And so there are these sort of social rules that we all follow. We're just not really aware of it. And so some kids who aren't naturally picking up on those social rules, they benefit, and there are tons of books for young kids.
Who needs to do this? We can do this. We can do it together,
And the 5-point scale that's referenced, this is taken from materials from...
the Incredible 5-point scale. Yeah.
Yes, a technique called the Incredible 5-point scale. And so there are different versions of this. You can draw it in many, many different ways and graph it in many different ways. But basically... the green 1, the blue 2, the yellow 3, the orange 4, the red 5, they coordinate with something along the lines of what does a 1 look like for me? What does a 1 feel like for me? A lot of times when I'm working with, trying to coordinate with a school, I ask kids to say, how do other people know I'm at a 1? What does a 2 look like for me? What does it feel like? How do other people know? How do other people know I'm at a 3 or a 4? Because some kids will do things like they'll put their heads down on their desk, and that's when they're at like a 3 or a 4, and they're very taxed. Their cup is almost all the way full, and they're going to maybe explode at home or at school, not at home. And so then if somebody comes by and taps the desk and says, come on, get back to work, that's all of a sudden going to trigger an explosion. And so making sure so that's the 5-point scale, is really labeling these different levels of escalation, sort of labeling the escalating feelings, and then
like the
triggers for what people could observe, or what are the tools that I use at those different levels, or what are the different tools I use at those levels.
All right, I think we had a question over there.
Hi, can you hear me?
Yeah.
So for being at a level 5, can you talk a little bit more about what adults should do when a child or a teenager is at a level 5? You mentioned stand back and let them have their time. What if that time becomes physical or violent?
You need to establish ahead of time where is the safe place that you're going to go. Okay, so having a conversation of whenever you get to this level, sometimes you feel out of control. Like you have described that you feel out of control, you might hit somebody. So speaking about it not in a judgmental way, but you might hit, you might kick. These are things that you've done in the past. Okay, where is the place that we can go when you're at a level 5, because I'm going to need to get you there. All right, establishing that ahead of time. When you see the person starting to escalate, starting to move them towards that place. So it's not a level 5 and you're suddenly trying to get the person to the calm space. If you see the level 4, and we know that a level 4 looks like the kid's really starting to kind of clamp down, or at a level 3, if we catch those early enough, we can try to get them to the safe space. If we don't catch them early enough, then if you're in a school situation and there's things like that, you might need to evacuate the room. But saying it's not that kind of a situation, you're at home and the kid's hitting and kicking and screaming and they're at home, then getting everybody else out of the room and just kind of sitting down. A key component to de-escalation is making yourself as small as possible, so making yourself as least threatening as possible. I was working with a little guy the one time who was having a hard time, not here, elsewhere, and he was on the table and he was really upset, and the school security guard was standing in front of him with his arms folded. And he was like, I said, we're okay, you know, I can handle. He was like, nope, nope, nope. And I'm like, this is not de-escalation, right? So making yourself as small as possible, using the calmest voice possible, controlling that anxiety curve, getting things out of the way that are going to be harmful, and letting that person, because they can only last up here for so long, right? This burst isn't going to be hours of screaming and hitting and kicking. That's exhausting. Okay?
But it can be hours if you're trying to intervene and they're not calm. So that's what, it's not always this neat like curve. A lot of times I think where it goes kind of awry is it's up, and then maybe you think they're getting a little calmer, and then you put a demand on them or try to talk about it, and then they're back up there and maybe even higher and it's longer. So I really think the focus at a 5 is on survival and safety. You know, so it's getting through it as safely as possible. If you do need to move somebody to a different space or go into sort of a safety plan, try to do it without talking and in a way that's like the least threatening as possible for the situation.
All right.
Okay.
Oh, we have one more. Great.
Hi. You mentioned freezing. Is that the same as shutting down?
Yes.
So my almost 15-year-old grandson, who has anxiety and learning disabilities, and is on the spectrum, will often shut down, just disappear, cover his head, stay in his bed for 5 hours. And are we to assume that it's anxiety that leads up to that?
I wouldn't assume anything, but I think that's a good hypothesis. I think you would want to look into it. You know, when Heather was talking about the full cup and the kids coming home and kind of like, you know, how was your day? And it's sort of an invitation for blah. Sometimes I think, and obviously this depends on everybody's abilities and what they can and can't do, but sometimes when you're coming up with a plan, part of that plan is like, sometimes kids will say, I don't want to hear a question when I come home. You know, I don't want to have to answer what I learned in school or what I did. I just want peace and quiet. So he might say, I just need to come home and like not have any sort of stimulation, not have any demands on me of talking or whatever, you know, and so then you might be thinking about, it might not be necessarily anxiety, it could just be that's his calming down, that's his emptying the cup, and then you might think about, you know, 5 hours is a long period of time. I imagine he has other things he might need to do, like eat or, you know, homework or go to sleep or shower or something like that. So, you know, you might be working at trying to shape that into a shorter period of time. Or if he knows there aren't going to be any demands on me for you know.
And how do you shape that into a shorter period of time? Because he refuses everything.
Well, I think it depends, but it could be that if he knows, oh, we'll leave you alone, we're not going to ask you to do anything, we're not going to talk to you, you know, and you specify, like if he's doing it for 5 hours, you say for, you know, 4 hours and 45 minutes, like go to your room or whatever, and so you just try to chip off a little bit, and as he builds that trust, if this is the reason why he's doing it, you know, if he builds that trust that, okay, you're not going to try to sneak any demands here, you're not going to check on me, you're not going to do this or that, as he trusts that, then you might be able to shave it down into, you know, 4.5 hours, or you might be working on teaching some other tools too to help him, or working with the school to try to figure out, like, maybe he needs smaller breaks throughout the school day so that it's not so built up. It's really hard to give a one-size-fits-all answer to that, because you would really need to look very carefully at what's going on with him.
And do you ever find that a child with social anxiety is so anxious about going to talk to someone that they won't talk to a therapist.
Yeah.
Yes,
Yes,
that's very, very common.
Then what?
Yeah, that is not
Great
uncommon. And
We've spent 3 or 4 sessions with his head under a blanket.
Okay.
Yeah.
And so continuing.
You just keep doing that?
If the therapist feels comfortable with it, usually it's kind of up to the therapist's comfort level with it. But if a child does not want to talk due to anxiety, we want to make them feel as comfortable as possible, but not letting them avoid the situation. So maybe shortening the time that he's there, so you're just gonna come and hang out in the waiting room, and I'll come sit out with you for a couple minutes, and then next time you're gonna come in and we're gonna go back. So that's the shaping piece. It's like, I want you to talk, but maybe you don't have to talk in here with me. Maybe we can talk in the waiting room for a couple minutes and just check in how your day was, So getting him tiptoeing towards an active therapeutic relationship can be helpful.
These are all great questions. It is 8:30 now, so I want to let everyone know that we will be staying behind for a few minutes after the program should you have any questions that we could not finish answering. But I want to honor everyone's time. And since we said programming's ending at 8:30, I'm going to stop the question and answer session now. I do want to say a few things. I just want to thank you all for joining us this evening. And I want to thank Drs. Dukes Murray and Barlow for lending their expertise to our panel this evening. Thank you very much. I'd also like to thank our advancement team for helping us with the programming this evening. And a special thank you to Renee Lewis. I don't know if she's in this room right now to hear me say this, but she's the Schaefer Center's administrative coordinator. And without her hard work and effort, these events would not be possible, and they also would not go as smoothly as they always do. So thank you very much. We also will have representatives from Lawrence School should you have any questions about our school. Feel free to ask anyone with a name tag. Oh,
It's just under
it's under my hair. With a name tag that looks like this. And remember to fill out your evaluation forms, please. That's very helpful for us. And you can turn those in to Renee Lewis or anyone who's holding a basket as you exit. And that is all we have for this evening. So thank you again for coming.
Thank you.